Hi, welcome back to the Medicare Show. I'm your host, Jeffrey Kuhn, and I've got a return guest, Eric Rule, who's been a great client for a couple of years that I invited back to have a really informative discussion today. So thanks for coming, Eric.
You're welcome. Glad to be here. Hopefully some of your folks, men, I think more than women, but potentially a wife might be interested in what happened to me and the great things that came out of it and so forth.
Yeah. So one of the things that, I'm always learning, and I'm always like, what is it that I've learned this year? Because every year it's a learning experience, and I'm like, okay, what can I share knowledge with other folks that might be in the same situation? You came to me and shared, it's probably over a year ago.
Oh, yeah.
Wasn't it? I don't know when this article was written that we're going to talk about.
It was a couple of years ago.
Okay. Well, there's a great article that was written. They interviewed you about an innovative prostate treatment.
That's correct.
I've never heard about it. I get calls from clients all the time about, hey, got PSAs escalated, things going on, and it's, they may ask me a few questions. I'm certainly not a medical professional, but I thought, you know what? You've had firsthand experience with this innovative prostate treatment. I want you to at least share with the viewers what exactly it's called and what it is.
Sure. So I had what's called BPH, or benign prostatic hyperplasia, which means non-cancerous. So it didn't involve my PSA score or anything like that, which is way below normal, always has been. But my prostate became enlarged like a lot of men, but mine became inordinately large at a younger age. So by my early 50s, I was having to go to the bathroom quite often, and it got to the point where in my early 60s, I wasn't getting a decent night's sleep if I got up in the morning. What happened is if I drove from here to Buffalo first thing in the morning, I'd have to have a Red Bull on the way there and back. Otherwise, I'd fall asleep behind the wheel. That's how bad it was.
Because your sleep was getting affected by having to get up.
Tremendously to urinate. Yep. So I talked with my doctor about it locally in Rochester, and he said, well, let's try Flomax. And I had read some things about Flomax, and I was a little skeptical that it would work, but I definitely tried it because it's the first course of treatment, and it had absolutely no effect in a positive way. So I began to explore alternatives. And interesting, I found that generally you have to push towards going to a urologist. The doctors don't automatically, your primary generally doesn't, from my experience, refer you immediately to a specialist. So I went to a urologist at one of the local hospitals as part of a group, and they sized it with a sonogram, and you get a pretty close idea of how big it is, which we'll get into later. But an adult male in their early 20s, they call it by either grams or milliliters, so I'll use the term grams. 20 to 25 grams. And most guys, when they get to be 80, if you live long enough, they get up to maybe 35, 40.
35 to 40 grams.
40 grams. I was sized in Rochester at 64 years old at 83 grams.
83 grams.
Correct. Which was, they recommend.
It's like triple
for an older guy.
Yeah.
Correct. And that's why I was having problems passing. What happens is the urethra gets restricted. Your bladder can't empty.
Yeah.
The muscle on the top of your bladder, called the detrusor muscle, gets exercised to a point where you can permanently damage the muscle, so you would never have complete emptying after that.
So does it feel like your bladder's like you constantly have to go and you're not getting relief when you go? I'm guessing.
That's exactly it. Oh. So what I did was they recommended either HOLIP, which is using a laser, done by hand, or TURP, which is the classic treatment, which is done with a cauterization loop where they go into the urethra and so forth.
Okay.
And I did research, and both had a relatively high percentage of impotence. Also permanent incontinence, 24 hours a day. You'd have to wear a diaper.
And that never changes. That's
never gets better.
Yeah.
And so I looked for potential alternatives, and I found one. It was called aquablation. One word, aquablation.
Aquablation.
Cut with water. Essentially, it's a robotic version of a water pick.
Yeah.
And they go in and they have a sonogram. They go into your rectum with a sonogram device, and it gives them a real-time 3D picture of the size of the prostate and where the blockages are and so forth. And and also with the other two procedures, the first two, which are the most common around here in upstate by far, there's only one or two practices across all of upstate now, and you have to go into a doctor's office to have it done because you're under general anesthesia.
Under general anesthesia, yeah.
Yep. And the reason is if you moved around, it cuts to within a millimeter. That's how accurate. And by hand, the other two methods are not as accurate. So they can do. That's how they can do nerve damage.
Yeah.
Because essentially you're looking through a keyhole.
And that's where the side effects, the risk is because they're
The
doing
nerve
it by
damage.
hand. The nerve damage.
Exactly.
And I'll tell you as a man, those two risks are probably the most fearful things as you're aging.
Well, the last one is there's almost an 85+% chance that you get retrograde ejaculation. For all those who are easily offended, now would be the time to turn off the video. So what it means is when you ejaculate during sexual intercourse or without, the ejaculate goes up back into the bladder. So it's dry, it never comes out. Where with an aquablation, depending upon the size of the prostate, the probability of getting retrograde ejaculation is between 12 and 7%. The higher it is, the worse it gets.
Versus 85.
Versus 85 to 100%.
Which, if you're a gambling person, those are really good odds. You're pretty much going to win that bet, or in this case, lose that bet.
Yeah, and afterward, and your wife tells you it doesn't make any difference. Of course, it makes a difference.
Yeah, it does make a difference, right? For a man, it's
it makes a difference.
Right.
Yeah.
I won't get into the other conversations that
we
you hear about, but it always matters.
It always matters.
Yeah.
So, what I did was I found procedure that was approved by the FDA in 2017. It was not. It was the company who makes the machine, which is a robotically controlled system, was tested in Hamburg because they don't have the same tight controls of the FDA that we do. So they use a lot of testing, drug testing and whatnot.
So it was 17, they finally approved aquablation. Was that done here? Was that done?
It was done here, but it was tested in Europe for years.
It already been in Europe for years, like most things are anyhow.
Correct.
Yeah.
Yeah. And that's good and bad things. But anyhow, I felt pretty confident. And it turns out I could have gone, they have a list of doctors on the instrument website.
Yeah.
I could have gone to New York City, which was difficult to get in and out of. It's a hassle. I used to work down there part-time. And I could have gone to Boston, a little bit longer runner. I could have gone to New Jersey.
Yeah.
And New Jersey, I had worked for a company the bulk of my career, about 25 years, that was headquartered in New Jersey at the time. So I knew New Jersey, and I felt very comfortable.
Very comfortable for you to go there.
I looked at the credentials of the doctor. I set up an appointment. Had to change my insurance that was pre-Medicare to go down there because my insurance up here did not cover it, and I changed to a different carrier. Got approval, went down there, got interviewed. Couple months later, I went for the surgery and or the procedure, as they call it, and it went pretty well flawlessly, except that when I told you that my prostate was sized 83 grams up here, the doctor almost backed out of the procedure because I was one of the first ones going in there. I have diabetes, not out of control, very controlled, but they put you in the queue first in case there are complications. And I stayed at Inspira Hospital, which is a chain in southern New Jersey. Excellent care, very nice people, teaching hospital, and so forth, down in Vineland. And the doctor was affiliated so he could do his procedures there. And his name is Dr. Thomas Muller. And he has his own practice out of Sewell. You pronounce it Sewell, or they pronounce it Sewell down there in New Jersey. Great guy. And it turned out as soon as he went in, he saw that the size was not 83 grams, as I was told in Rochester. It was actually 116 grams.
116.
Which is about if you do the math, it's about 40% larger. So that made him change his whole direction on how he had to go at the problem. He's done larger ones. At that time, he had done about 60 procedures. You have to do about 30 with the robot before you're really proficient. And he kept statistics, and he told me during the interview process when I went down there pre-procedure. So I went through the procedure. Got out in a couple days, stayed in New Jersey. He had a bunch of questions. And he responded. He gave me his personal phone number, responded within a matter of minutes. And even when I went back up to Rochester and I had some questions, at most he took about an hour to get back to me during the day. Normally, even on the weekends, he got back to me within 2 or 3 minutes early in the morning. I've had some decent doctors in the past and one really good one, but only one like him.
Just responded that fast.
You get top treatment like he's a member of the family.
So Eric, I want to ask you a couple questions.
Sure.
Because as you're telling me the story, I'm thinking about, I get questions all the time from clients that have a procedure, right? I know from other clients what to experience, right? And it's the simple one, like very common thing, people are like, I'm nervous about it. It's such a simple procedure as cataracts.
Yeah.
And they always ask, what's that like? I actually had that done at a pretty young age. And I can tell you firsthand, I can reassure people it's nothing.
It's nothing.
So when you're looking at aquablation, right, and you said, okay, you decided, you did your research, I want to do this.
Yes.
You made the initial phone call, and when you selected where you wanted to have it done, how long did it take from that phone call to where you actually had the procedure done? Like, what was roughly the time?
I had the phone call. I found out that my insurance probably would not work.
Yeah.
So I changed my insurance in real time.
Yep.
And then I called back and got an appointment within 2 weeks for the interview. That was in the first Wednesday of September. And I had the procedure done. I could have had it done in October, but I was busy with work. So I had it done in the second Wednesday of November.
So it could have been within 2 months.
Correct.
You pushed it because of your own schedule at 3 months.
Exactly.
So when you were down there, you had the procedure done. How long? Do you remember how long the procedure was?
Well, I was knocked out, but I was roughly about an hour.
Did you spend the night? Because you said you were there for a couple days. Were you there
spend
overnight?
overnight, and they flush your bladder out
Yeah.
with 30 liters of saline. And it's, I won't kid you, it's a little bit uncomfortable. And you're weak because you lose blood during the procedure. I didn't have to have a blood transfusion or anything, but they take your blood type in case there's a problem.
Yeah.
And you have pinkish blood in your urine for 2-3 weeks afterward, and then you'll have some clots after that.
As things are healing up.
As things are healing, because what happens is you rebuild the epithelial cells on the inside of your urethra, which are blown out. And when you do that, the first couple of weeks, as you urinate through there, you can feel the acidic part of the urine. It I wouldn't say burns, but it's a little uncomfortable.
Yeah.
But I went from being able to barely go urinate maybe a foot out to 5-6 feet out. Like I was 20 years old again. It's
like you're in the fire department.
It's unbelievable.
Yeah.
And my sleep got better. I lost some weight because of that.
Yeah.
And then later on, I went, like I said, on Manjaro. That's a different issue. But I lost about 20 pounds just from getting better sleep. So you don't eat as much. You don't need as much energy.
Yeah.
And,
trying to keep yourself, I would say hyped up. I do that once in a while with caffeine if I'm dragging.
Right. Well, sometimes if you're really
it's
dragging, you need extra food. And
right.
Because I wasn't sleeping well. So that in and of itself.
God.
And then I would say you were fully healed after about 7-8 months. The healing starts, and it's an interesting curve. You heal very fast at first for about a month, and then it goes much, much slower, and until you get.
Was there a little discomfort at all in that longer term, like out a few months, or
no? Once you're out 2-3 months, there's no discomfort at all. Yeah. There's only discomfort, I would say, the first month and a half or so, and it's not searing discomfort or anything like that. It is uncomfortable, I gotta say, but. Knowing and seeing blood in your urine after about a week, and you wondered, is this normal? And I am Dr. Muller, and he gets right back to you and says, and I shoot him a picture. He says, yeah, perfectly normal, don't worry. And
okay,
that's very reassuring, especially since he was about 350 miles each way.
Why do you think a procedure like this to me seems pretty cutting edge, and for men, why would you do anything other than this? But yet, you don't hear people talking about it. It's not implemented in a lot of different
That's
places.
because we are not in a cutting edge area of medicine in
Yeah.
upstate New York.
There's a few places, right, that have it, but you don't see
That
it
only was
broadcast.
very, very recently.
Yeah.
It was really the early adopters were New York City, Boston, in and around Mass General, people who practice there have the right to practice
Yeah.
there. The other place I looked, because it's direct plane flight, was Atlanta, Georgia, had it.
Yeah.
Naturally, all over New Jersey. They had it. I talked with a practitioner in Toronto. It would have been perfect, except with the Canadian healthcare system, it was socialistic. He couldn't have taken me, but he recommended
Yeah.
what I should do and how it should be done. He would have been the logical choice, but he was very polite. And he got back to me on a Saturday
Yeah.
when he knew he couldn't make any money on me.
Just
So that
still
was kinda
responded.
nice.
Yeah, it's shocking. What's going on?
Compared to some of the experiences I've had with
Yeah.
folks.
Yeah. Well, I'll tell you what, it's, for men, I think it's something obviously you want to be aware of if you're in that position. This is great information. And the fact there's still just a few places, I would say, and, I'd do the same thing.
Less than 200. If you go on to the robotic website for aquablation, it lists all the practitioners
Yeah.
and their locations and so forth.
And that's all listed in the article, Eric. So where the locations are, or no? 'Cause-
no, it is not. You have to look up, just type in aquablation. It'll bring up about who the robot manufacturer is. I forgot the name. And you put in your zip code and you put in a mileage radius, and it tells you who does it.
And the thing I think that I remember you saying is there's a big curve after they've done 30 procedures. So I think it's important. If I was thinking about I want to have this done.
You want to go with somebody at least with 30, if not a
More.
couple hundred.
Right. So it's even though people are offering it, you may want to do your homework and say,
Right.
okay, how much experience does this
Or you go to a
person have?
practice where one of the two of the doctors has done a bunch, and a person who's just starting is under their supervision during the whole time. Yep.
Okay.
And they have a dead man's throttle. It's like they put their foot on a pedal. The robot is in. They get it situated. And they get it targeted and aligned in 3D. It's in 3 dimensions. They got to worry about. And then they take their foot off, and the aquablation starts cutting. Goes.
Just does.
And if there's a problem and it's starting to go out of kilter,
Yeah.
the doctor lets his foot up or her foot up,
And
it
just stops
immediately so that you can't do any damage. So it's and they're already out on their second generation of robots, maybe their third by now.
It's amazing what they're doing now. Like a lot of procedures are done with robots.
I did not want something done by hand where they
right.
look through a keyhole and can damage your nerves, because once the nerve damage cannot be undone, whether it be impotence and or incontinence.
Yeah.
So that was my concern.
When you say impotence and incontinence, right? Was it 85%?
85% are retrograde ejaculation.
That's what it was.
More
Okay.
traditional, not impotence or incontinence. But if you take a look, while the incidents are relatively low of TERP, impotence, and incontinence, and the same thing with HOLIP, it's a factor. Even so it's low, it's a factor less with it's almost unheard of. How's that? It's almost unheard of with aquablation.
Yeah. And as a man, I mean, those are two major.
I thought so.
Yeah. I mean, if there's an alternative to that, I would, there's no.
It's definitely worth exploring.
Yeah, worth exploring. So it's a great article, by the way, Eric. I appreciate you sharing it with me.
Sure.
And if anybody wants a copy of this, you can certainly email me and request a copy of Eric's interview on aquablation. Simple email address, it's the Medicare shop at Gmail, and that's the Medicare, and shop is spelled SHOP. And just request a copy of the article. I'm happy to send you a PDF. So I really appreciate you coming in, Eric, and sharing the story.
Anytime. As I said, there were a number of guys who went down there from Rochester and refused to have an article written about them. I guess that they were a little bashful.
Yeah, I mean, I was just thinking, you must have been reading my mind, because I'm like, this is not something men are comfortable talking about.
Well, I was raised by Europeans, so we talk about that stuff a little bit easier.
Yeah. And
if it helps one person, I'm happy.
Yeah, and it's a great story, and I think it's a great procedure that certainly people need to be aware of, because it's, it is cutting edge. I mean, it's been around for a few years, and I think a lot of people would like this information. So thanks again, Aaron.
Anytime. Thank you.
Okay. Appreciate you coming on.
Yeah. Bye-bye.